I think the idea of smoldering disease, or at least a smoldering component in MS, stems predominantly, I would say, from the frustration of physicians who have been, for over the past 20 years or so, have been using extensively disease-modifying treatment. And in most of cases, we succeed in suppressing efficiently relapses, focal inflammatory lesions detected on the MRI. But yet, a large proportion of those patients whereby we succeed therapeutically in preventing any form of focal disease activity still are reporting some form of disease progression or worsening. And this highlights a sort of discrepancy. On one side, we are very good at preventing any form of focal inflammatory disease activity, either symptomatic with relapses or asymptomatic detected exclusively on MRI. On the other hand, this discrepancy highlights that there are some other mechanisms probably accounting for a more subtle, less dramatic disease worsening, which is very difficult to detect. And therefore, I think the first observation that were a major breaking through in the field that brought clarity in the concept of smoldering MS was the observation from the trials of rockerizumab, which made possible to highlight that many patients, despite successfully suppressing relapses and MRI activity, were still, and despite being labeled as relapsing remitting MS, were still experiencing some form of motor deterioration, which eventually was labeled as progression independent of relapsing activity, the so-called PIRA. And that was, I think, the starting point of the concept of smoldering MS. A smoldering MS, which we believe is a broader concept than PIRA. It obviously encompasses PIRA. PIRA is definitely a big component of smoldering disease. So the progression independent of relapsing activity is part of the smoldering disease activity. The problem is not necessarily a problem. PIRA has an intrinsic limitation because its definition heavily relies on the use of EDSS plus, which is a scale that combine the EDSS, the T25 walking test, and the 9-hole pike test. All the three combined scale tend to put a specific emphasis on the motor performance of the patients. Therefore, the definition of PIRA, it's very much focused on the motor impairment and tend to ignore worsening in many other disease domains. And so we had a lot of discussion about the potential limitation of PIRA. We decided that it was the right time to broaden the concept of a progressive element of the disease that goes beyond PIRA. Of course, PIRA is a big component, but it goes beyond that. And therefore, it includes other symptoms that are not fully captured by the definition of PIRA, such as, for instance, cognitive worsening, accumulation of fatigue, pain, accumulation of bladder or bowel disturbances, and also psychiatric disturbances such as depression. So it's a much broader concept that PIRA itself. So in practice, we wanted to frame with a consensus among 15 experts in the field, try to frame and give like the right framing to the concept of smoldering disease activity. We eventually coined these new terms, which we call smoldering associated worsening, in order to label all the different aspects of disease worsening, which we believe is related more to smoldering disease activity rather than activity, focal inflammatory activity, which drives relapses and the formation of focal lesions on MRI.